Hello, 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 everyone. Welcome to another episode of Sree's daily global COVID-19 show. My name is Sree Sreenivasan, and it's my honor to have this global conversation that we have every day to try and understand what's happening around the coronavirus pandemic. We don't talk about the news necessarily, but we talk around the news, and every day we try to bring you some light, some insight. And today we have a very exciting show, and I can't wait to tell you about it. First, let me tell you who our guest is. Dr. Marina Kurian is an MD. She's a general surgeon. She's president of the New York State chapter of the American College of Surgeons. And this is episode number 676, and we're calling it Ask a Doctor. She is one of 24 doctors that we've had on the show in 76 days. And we're just so grateful that she is here with us. And you'll meet her in a couple of minutes. But please follow her on Twitter. She's at Marina Kurian. And on Instagram, she's MarinaKurianMD, M-A-R-I-N-A KurianMD. You can see that right on the screen. We hope you'll follow her on both platforms, and we'll remind you to do that. We're live right now on Twitter, on Facebook, on YouTube, and on LinkedIn. Please find me on all those platforms, and please share to those platforms and share with your friends. Tag them. You certainly know somebody who has a question for a doctor, an eminent surgeon like Dr. Marina Kurian. This is your chance to ask her a question. I have so many questions, but so do you. So please do that. Let me tell you a little bit about myself. If you're joining us for the first time, I am the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism, and I'm a freelance journalist, and I run a company called Digimentors. And what we do is help take people's physical events digital and help them with their social and digital consulting. And these are some of these services we offer now. We help you convert your in-person events to virtual events. We help you make your own live web show. We help you with consulting, training. We can be 10% of your production team or 110% of your production team. Please talk to us before you cancel your in-person events. Really important. We want you to remember that as you are looking at your events and what you decide to do this year. We want to thank our sponsors. Also, we want to thank Priyamvada Sustainability Consulting. Let them be your chief sustainability officer. They offer all kinds of consulting services to help you think about a cleaner future, and their website is clean-futures.com, clean-futures.com. A big thank you to Sonali Chitre, who is our sponsor at Priyamvada Sustainability Consulting, PSC. Go to clean-futures.com. And before we bring you the doctor, we want you to make sure you tag a friend. Tell us where you're watching from. Hit retweet. Find her on Twitter and retweet her or follow her. Find her on Instagram and follow her at Marina Kurian on Twitter and at Marina Kurian MD on Instagram. And before we bring her on, we have one more piece of business to tell you about this wonderful new course that we're offering. Wonderful not because I'm teaching it, but wonderful because it's a free certification program available all over the world for free in June. Anybody in the world can take it, no matter their background, their experience, and their interest level. And also, we're aiming at a journalist and public relations folks, but everybody in the world is welcome to take this course. Sign up today, mrac.co/social. Certainly you know somebody in the world who could benefit from this. Take a photograph, take a screenshot, and save this right now. Our friends at Muckrack Academy and I were talking about what we could do. Many of you know I lost a very prominent job, and I know how hard it is to have one person out of work in one family, and to look at 34 million Americans out of work and millions around the world out of work is really painful. So the least we can do is help you upskill and draw a baseline knowledge for everybody in the world who'd like to take this course. More than 3,000 people have already signed up. You can sign up. It is free, and you can sign up at Muckrack or mrac.co/social, mrac.co/social. Please share that right now so that your friends and family can participate as well. All right, are you ready to talk to a doctor? Because I certainly am. One of the things I'm doing is I'm so confused about the lockdown. We're on day 76, And this is episode 76 that tells you we've been locked down for 76 straight days. All right, here we go. Please welcome my good friend, Dr. Marina Kurian. Here she is. Hello. Oops, 1 second. Sometimes technology makes trouble. And there she is. Hello, can you hear me? I don't know if she can hear me. Sometimes there might be trouble. Let's see if she can hear me. I don't think she can. Let me try one thing. If she gets kicked out, she'll come right back inside. Some of this happens sometimes with technology. Some of you have been with me with 76 straight days as we've tried to do this. And sometimes we've had trouble, sometimes not. Our guest is going to be in a few minutes. You saw her there already, but she'll be back. Dr. Marina Kurian, MD. Please follow her on Twitter. She's already back on the screen with us. We're so sorry that we had tech troubles, but sometimes that happens. Hello.
I thought it was me, so it's okay. It like bounced me into a different, like not a bad chat, but it was just like, hey, learn more about StreamYard. I was like, no, I'm going back.
Well, thank you for coming back. And we're so grateful to you for being here. You've been on this show multiple times. You've also been on my other shows, my New York Times Read Along, where we read the New York Times and the Sunday mornings, 8:30 to 10:30 a.m. You've also been on my WBAI show. In fact, you are our very first guest on WBAI when we started that show now 2.5 months ago.
Oh,
it's hard to believe it was a call-in show. And by the way, as you know, you've not lived till you've been on a call-in show in New York where people from the extreme right and extreme left call in and yell at you, which it didn't quite happen to you, but started happening after that first show because people are so sure they know the answers. But isn't it true, doctor, that the fact is nobody knows the answers, right?
No, nobody knows. It's 100% true. I mean, we are learning things all the time about COVID. We're learning about what are good tests. We're realizing that every antibody test is not equal. There's so much information that we don't know and so much that we can learn. It is actually sadly a terrifying time in terms of how we can't predict the future at all with this illness. But modeling and looking at like mathematical modeling of the virus and other parameters to assess what it's going to do is helpful, but the research that we're getting out of this is a tremendous boon to all of medicine. And what we learn about this virus is going to help us learn about potential future pandemics and what are best strategies to try and deal with specific viral pandemics that occur, such as this one is so much so a respiratory droplet situation that it really has changed how we all have gone about our day-to-day activities. I mean, you know, you walk outside without a mask now and it's like, oh my God, I forgot my mask. I got to go back inside. That used to be the way I was with my cell phone. And like 20 years ago, I would have been like, okay, where's my purse? I got my purse. I'm ready to go. But now, you know, there's all these other different layers of things that you have to have before you walk out the door.
And that's such a good observation that it became routine for us to carry a cell phone and to remember that you can't leave your house without one. And that could be a new normal. Doesn't mean it'll be the new normal for everybody and it'll always be the same. But how do you think we're doing? Or if you had to grade like New York City overall in these 76 days in terms of listening to the advice, taking our medicine, so to speak, how do you think New York has done?
I think that I've never been prouder to be a New Yorker. I've said that before on your show. I feel that New Yorkers really did buckle down for the most part. You're always going to have some outliers. You're going to always have people who, you know, can't take a run with a bandana around their face, right? And they have to run without it. I got in an elevator with one today. I mean, but I had my mask on. But I think for the most part, we come together and we did actually do what we're supposed to do for the most part. And I think that is why our curve flattened and it looks so good right now. The numbers look pretty good in New York. And I think it's completely because people did what they should do in terms of monitoring themselves and quarantining. I mean, I've been doing telehealth since March 17th. So happy St. Patrick's Day, telehealth. Right? Telehealth style. And everybody was already at home and nobody was going to work. And that's been going on now. I've seen people twice or 3 times, excuse me. I saw them in March, April, and now May, because I do monthly visits with certain patients. And, I'm like, oh, you're in a different part of your apartment or your house, but they're home. They haven't left except to do grocery shopping. And most all of them, if they have elderly kinfolk, are staying away from them, which is good and bad. We were talking before the show. Did I say my mom is getting a little squirrely? She needs to leave the house, and she's, older. I can't state her age, because she will be mad. But she's much older. She's in a high risk age group, and I may actually take her to work with me, just because I think that she needs to get out of the house. And my office is very safe because, first of all, we wipe everything down, and we're wearing masks. And when we have patients come in, the patients are wearing masks. But also we're pre-screening all the patients that are coming to our office and asking them if they've had any symptoms. And so we have a strict questionnaire that was also put out by the Medical Society of the State of New York, but a lot of different CDC has put out stuff, the AMA has put out stuff on when and how to see patients. But it's affected a lot of people, and there are a lot of mental health struggles that are going on as well. It's such a complicated issue. I'm sure you did a show on mental health, but it's so complicated in terms of how people are affected. People who haven't had, I saw a patient today, he hasn't had a panic attack in years. He's had 3 in the past 2 months. It's hard because it's the unknown. And when you're standing online to get into the grocery store and someone coughs online, you're like, really? What's with the coughing? This is not good.
Yeah. And that's certainly one of the many things that we can talk about in terms of this conversation tonight. But we do want to just give a shout out to your mom, who was a nurse for many decades at a New York City hospital. We'll say not decades, just a couple of years. She's so young that she didn't have decades to practice. But
she's been retired for a couple of decades almost.
But we're family friends, so I can say auntie, as we say in our Indian culture, our Kerala culture, is an amazing lady. And it's nurses and doctors and everybody who we salute, and we salute them right now. We just had the 7 p.m. salute, right?
I was outside for it. It was really, and people are still doing it. It's not like it's waning, and I think that's wonderful. And the unsung heroes are the people that you don't see, like, of course, the nurses and doctors, right? But also the people who clean the rooms, the people who make sure that the hospital's running, the people that help even in surgery, our scrub techs. It's a lot of different people that make the hospital work, and even our administrators are working full time and double time, actually, to make sure that everything is going well, and that we're all sort of following the rules and trying to make sure that we mitigate any upticks or any surge with COVID. And I think that all the hospitals are doing a very good job of that.
No, we continue to pray that everybody will continue to be able to do what they're doing. We actually had a nurse on my show from Northwell last week, and it was amazing. We said nurses are heroes because we don't get to see them on these TV shows and webcasts and things for a variety of reasons. As you know, hospitals don't always let them go out and speak. And also, they're not in kind of private practice. Kind of, you're your own boss, so you can do, whatever you want. It's a little different for nurses, but we had a nurse come on, and everyone was kind of cheering for her. It was so nice. And one of the things she said, I'll never forget. She said, "We try to give our patients a good life, but if not a good death, a peaceful death." And just to think that so many people have died in New York and everywhere, and nurses and doctors are the last people that get to say goodbye.
Yeah, well, and they try to, I think the nurses are more at the bedside than the doctors in many ways, and they really do have more of that rapport and relationship with the patient, even though, when I bring my patients in for surgery, they're only in the hospital 1 day, right? But for the patients that come in sick, they see their nurses, and there's usually continuity of care. So they're seeing their nurses several days in a row, and they have been the ones to hold up that iPad or the phone so that the person who is sick or not feeling well can see their loved one, because all the hospitals have stopped having any family members or any support other than, the staff in the hospital at the patient's bedside. So that's incredibly hard. And I have a friend who lost her mom like that, and the friend is also in healthcare, and it had to have been the worst thing in the world. You're basically dropping people off at the ER, and then you can't go in, and then you end up having a death from something like that, and it's just a devastation because you don't. FaceTime is great. I've said before, like my son went to college a couple of years ago, and I was like, how am I going to deal with that? My daughter's going, and I used to joke with them, I'm going to FaceTime you every day, and they would look at me like, no, you're not. But FaceTime does make up for not being there. But when you're sick and you're not, there's a potential for you to die. It's just not enough. But it's at least something that certainly at NYU and Lenox Hill, they've made sure that you can have an iPad or something there in the room so that they can actually be conversing with their family while they're in the hospital.
Yeah, thank you for kind of sharing that, and so that people understand how complicated and difficult this moment is. Now, before we ask some questions, let's do what we call our global tour, where we see who's tuned in. People are telling us from all over the world where they are. Please continue to tell us where you are, ask your questions of Dr. Kurian, and we will come to you. But let's start. Anand Babu is watching from Andhra Pradesh in India. By the way, as I name these places, you can tell us as if you've been, you have any favorite memories or anything about food or places, because I know you travel a lot, so you can tell us. I
haven't been to Andhra, I can't say, but we have very good friends. I'm sure they're mutual friends that used to live in Delhi that were from Andhra. So it's funny, like some of the words are similar. Like, you hear people talking and they're like, I think chillera is the same as chillera, which means like change, right? It's the same. So that I haven't been to Andhra.
Okay, so you'll have to go. So part of this is, with my guests, we're making like a bucket list of places we all have to go after when we can travel again. Jonathan's watching from Union Square. What are your memories of Union Square right here in New York City?
I went to Stony. So Union Square is where I came in on the 6th train. I lived in Manhattan, so I come into Union Square, then I'd either walk down to Stuyvesant, when Old Sty is now what we call it, down on 15th, just between 1st and actually the park there, and so I'd do that or take the double L. So and I was just there earlier today. Actually, I went down there for a visit.
And Stuyvesant High School, for people not watching or not from New York, it's one of the best high schools in the country. It's a free public school. I have to say that because when people from England or India hear the word public school, it means very private, but Stuyvesant is is a free government school, and it's very good. But it's moved since our day, right? It's moved all the way to the west side. But so you used to hang out. Do you remember any of the stores or restaurants?
Oh. Yeah, okay, so back then it was still semi-illegal, but McSorley's used to be down there. They closed. It's one of the oldest ale houses in New York City. Vinieros, which is still there. I hope they last through this pandemic, but they have the best cannolis, I think. Okay, we can fight about it later, but Vinieros has darn good cannolis. And then what else was down there? There used to be a deli that was down there. I can't think of the name. And then across on that same street was Ambrosia Diner, like on First Avenue and 16th or 17th, that we used to go to. But not there anymore.
Yeah, New York keeps changing, right? Isn't that what Seinfeld said? One day it's an Indian restaurant, then another day it's a Chinese restaurant, and then it changes again. And that's the rhythm of New York. But we worry so much about those small businesses now. Yeah,
it's that has been also a true devastation. The economic impact of this is horrific. And I'm a private practice, but I run my own business, and doctors used to be actually one of the largest small businesses in the country. And many of my colleagues, there are some helpful hands from the government to try and help, but it's still, especially in medicine, our stuff isn't so immediate. It's not like you fix a car and you get paid right away, or you're changing the tires and you pay for the tires, right? Like for us, we submit everything to insurance, and insurance can take anywhere from, 2 months to 6 months to pay you. And then also they give you a lot of runaround. So you end up spending your staff, when I say you, it's the royal you, your staff spends a lot of time trying to track down the insurance company money. So doctors actually are in a bit of jeopardy, I think, right now, because unless there's real guidance from, I hope, Governor Cuomo, and I'm speaking as the president of the New York State chapter, that insurance companies should not withhold payments to doctors across the board, but that can certainly impact one of the largest groups of small business across the country, which is physician offices. We employ a lot of people.
Yeah, and thank you for all you do, and all your colleagues at the office who've been able to work and do so much for all of us. Let's keep going. Jerry's watching from Guatemala City.
Nope, haven't been there. Wow, I have been to Latin America, but
how about Kerala? Ashok is watching from Kerala.
Oh yes, I have been many a time. It's God's paradise, right?
It's God's own country, they say. And my friend Hita Herzog, she says, I'm so glad this is happening. Hita, we need to have you on the show, so please ping me. And Ashok says, welcome, doctor. And people are watching. Jeevan's watching from India. Steve is watching from New York City. I'm cycling virtual circuits of Central Park via the Zwift app. So
that's good.
Yeah, so everybody can note that if you like cycling. You can check that out. And Steve is on my team. We do amazing work, and he's really an amazing producer. We do our New York Times read along, which you've been on, where we read the New York Times on Sundays. He's just terrific in that role, and we're so grateful to him. He's watching from Philadelphia. What is your favorite Philly story?
I have been to many a time. Probably the last time I went, I met up with my sister, and we went to eat at this small divey, the Indian restaurant. Maybe not so divey, but like it was just small and seemed out of the way, but it was really good food.
Why are so many Philly stories about food? It's like they have such good food there.
They do. Yeah, they do. It's also the city of brotherly love. You can't walk down the street without someone talking to you. And you're like, love you, brother. I'm from New York. We don't talk to each other like this.
Exactly. But by the way, when we're wearing masks, we seem to be saying hello more. I don't know if that's, I'm just imagining it. But when I'm walking our dog, by the way, our dog is doing her part. She's only walking twice a day instead of 4 times a day. So she's trying hard.
Yeah, my dogs are adamant. They're like, we got to go out. We got to go out now. I'm like, oh, okay. Yeah.
Here's our first medical question. What's the side effects of hydroxychloroquine? We've heard so much about this drug, and people are still having questions. But by the way, this Twitter user's name is unusual. Infested Brain is the name of the Twitter handle. So let's set that aside and talk about hydroxy on its own, please.
So hydroxychloroquine is given to a lot of rheumatoid arthritis patients, and there's actually some concern. I just saw something today that the patients feel like they may not have access to hydroxychloroquine for their existing condition. The studies, so there was some touting the effect of hydroxychloroquine plus azithromycin, which is an antibiotic. If you've ever taken a Z-Pak, that's azithromycin. So together, that those would help with COVID symptoms and keep you out of the hospital and or cure you. And the issue with that is, while a lot of things can be anecdotal and you can see success in 1 or 2 patients out of 4, and you think, wow, it's 50%, you won't actually know until you do a larger scale study to see if the results that you're seeing are not like a selection bias, that you gave it to people who weren't that sick. And so, they might not have gotten that sick. They could have been the patients that had lesser symptoms or would have had a milder form of COVID. So you don't really know if it was the medication or the course of the disease itself, or the way that the patient handled it in terms of their own immune system. So anecdotal stuff, not good. So the most recent couple of studies, and there's been a few that have been run, not counting that first one, which is the French study that came out, which was only 16 patients, right? Long answers. You're going to get long answers about all this stuff because you have to. There's no real short answer. Hydroxychloroquine, in and of itself, does have certain side effects. the issues that we're worried about with that combo of hydroxychloroquine by itself and or with azithromycin is that it can prolong phases of the electrical conductivity of the heart, and in particular something called the QT interval. And so therefore you can have issues with arrhythmias and or heart attacks or cardiovascular issues that can result in death. And so when they looked at the patients that were in the hospital, and this is a study that was done in multiple different sites, but the publications are just still coming out. And I believe it was the CDC that stopped the study because they felt like the data showed that if you were on hydroxychloroquine, there was a disproportionately higher rate of death and usually related to cardiovascular complications. So
yeah.
Wouldn't take it. I mean, yeah, it's so hard to monitor. If you're just taking it at home and you don't know your underlying condition, you don't know if you already have a slightly like upper end of normal QT interval on your heart, I wouldn't take that medication because it can certainly affect and change things. And here you are trying to take something to prevent death, and yet it can ultimately potentially cause your death, you know.
And it's so crazy the way people have misunderstood this particular research, right? It was very early in the process. It hadn't yet been peer reviewed all the way. And it was good for people to know that there were some promising results, but not the way, and then take it on as if it's, you know, it's going to prevent you from getting sick. And the president, we know he lies every day. He lies. So now that he's saying that he's taking it, we don't know he's taking it. And there was that unusual moment where Nancy Pelosi said he's morbidly obese, he shouldn't be taking this, and then he called her, you know, having mental issues, and all of this is hard to believe at this moment where we are in America. The last thing we need is leadership like this in the White House, but that's what we have. We're trying not to be political, but the same thing happened with the disinfectant and the lights and everything. Anyway, let's move on because otherwise we'll just get stuck. Let's see who else is watching, folks. Tell us where you're watching.
I'm not a psychiatrist or a psychoanalyst because that is what is level needed for that discussion. So that's why I'm just like rolling my eyes. I'm in status rollicus, as I call it. Status rollicus.
Well, you've had teenage children, so you know how to deal with that. You've encountered your own share of eye rolling.
Yeah. Well, apparently I'm a huge eye roller. I didn't know. I'm like, I didn't roll my eyes. I just happened to look up that way. And they're like, yeah, that's your eye roll. We all know it. I'm like, oh, okay.
But I think it removes your power if you start eye rolling your eyes, because then they're like, well, then we're allowed to roll our eyes too. Ashok says, cool morning. I'm having my morning tea. It's 6:30 in the morning in India.
Yeah. I like tea as well.
And our friend who asked about the hydroxy is now giving the dosage. Please, folks, do not listen to people who are not doctors and assign yourself the dosage that you want to take. That is not how this works. This is part of the reason we're in the trouble we're in.
To some degree, I just think, you know what, you should be talking to your doctor. Science wins against this virus, not like common sense. Common sense is not really going to win. Science is going to win. Now, once we've established this, you know, you should wear a mask. When you're leaving your house, you're like, should I wear a mask? Well, common sense would say that I should probably wear a mask because, you know, I mean, that makes sense. But it's not, you know, the nerds think of, did you see that video? The guy Taco from the League. I can't think of the actor's name, but he put this whole video up as "Thank God for the nerds." I was like, yes, thank God for the nerds, because they're studying this and they have all these things that they think will help. And you know, time will also help. Heat, the change of the seasons. I mean, people are wondering if coronavirus. This is a coronavirus. We've had other coronaviruses, which are common cold coronaviruses, not as lethal as this. And if it's going to follow the same course, and if that's the case, there is some seasonal variability with the disease.
And so we can hope that that's what happens with this disease as we go forward. So let's see. We don't know, and that's what we keep saying. I'm
going to say right now, I'm not taking hydroxychloroquine, and nobody in my family is, and I wouldn't even let my kids take it. I just don't think the data is there, and you know, if I'm not willing to give it to my children, wake up.
And people are giving us a
I'm not giving it to my kids.
Yeah, no, that's that strong Indian mother in you. And I will say that one of you said nerds have won. Another set of people who have won out are Indian mothers, because they're the ones who told us, take your shoes off, wash your hands, don't touch your face. All of those things are now coming true. And you lived that with your parents, I know.
Well, I did it with my kids. I'm the only mother who's at the Colosseum in Italy, in Rome, going, don't touch that wall. People have been wiping their boogies on that wall for centuries. Okay, you stop it. Now I have to get out a wipe and wipe your hands. And they're like, you're so crazy. I'm like, okay. And the moment I said they've been wiping their boogies, they're like, yeah, you're probably right. That's what's been happening.
I have bad news. It's not even centuries. It's millennia that they've been doing that.
I probably said millennia, but yeah.
Here we go. It's morning in India, and Alok has a question. Can COVID-19 enter the body through eyes? And this is something that came up, as you know, after that very famous doctor
was
on TV, and he was wearing PPE and everything. And he said that everything was covered except his eyes. So can you talk about that, please?
So that is the odd, yes. So I guess, and he's an infectious disease specialist, and he really feels that's how it entered, and it's possible. It's why we're saying, don't touch your eyes, don't touch your nose, don't touch your mouth. All those areas are potential areas for entry. In general, when we're in full protective gear, we have a face shield on or goggles. When I operated on one of my on a patient that I wasn't sure of the COVID status, and this was early on because we couldn't get the test and we wouldn't have gotten it back in time. It's way before everything sped up and we got arguably better tests, just faster tests. So I don't know. In our minds, that's better. I had face shield on. I had eye protective wear and a face shield. I had 2 hats on. I mean, we really went all in to do this operation. But again, I'm being more invasive than when you walk into a patient's room to talk to them. But this was just a case where, I felt it was adequate because of the uncertainty, and I didn't want to take anything home because I have 2 elderly patients, et cetera. I have to believe he's an infectious disease specialist, that if he feels that's how it happened, then, but it's hard to say, right? Because what if it was also at a time when everybody wasn't practicing social distancing? Because at the hospital, once we're done seeing the patient and we take off all our protective gear and we put it down, we're used to huddling. We kind of do a huddle, we talk together. And so that can sometimes be, where you transmit something. So I don't know. I mean, I feel like it's a possibility, especially because I believe the doctor was an infectious disease specialist, and I'm the surgeon here, but as a doctor, I feel like it is possible that you can certainly do that.
Folks, if you've just tuned in, we're about halfway into our conversation with Dr. Marina Kurian, who is a surgeon here in New York City. Let me just show you the banner that we've put up for her. She is joining us right now. She is the president of the New York State chapter of the American College of Surgeons. And we're just so grateful that she would spend part of her Tuesday night with us. She's on Twitter, Marina Kurian. Her Instagram is MarinaKurianMD, and she's a general surgeon. She'll tell us what that means exactly. And by the way, since the last time she was on the show, she has even had the chance to perform her first surgeries in a couple of months. So we'll hear what all of that has gone, how that's gone, how she's felt about it, and what it was like to be doing what you love and being in that room with your colleagues and doing that great, important work. It's kind of that magic that happens in an operating theater. I want to remind all of you to please tag your friends right now. Please hit share, bring them all in so that they can join us. Anyone who has a medical question can ask it right now. And please share this with your friends and family. So please tag your friends right now. Please hit retweet. Please hit share. We're live on Facebook, Twitter, YouTube, and LinkedIn at the moment. And we love that we can bring these comments in from around the world and have this global conversation. This is episode 76. We've been doing this for 76 straight days. I need to give a big shout out to our 2 producers who make this possible. Vandana Menon, Vandana_Menon on Twitter, and Rose Horowitz, Rose Horowitz 31 on Twitter. Please follow both of them. They're tweeting right now. You can see the hashtag we're using is Sree COVID-19 call, and that will help you find our conversation. And the best way to track all my shows is to go onto YouTube and youtube.com/Sreenet, youtube.com/Sreenet. You see it right on the screen, youtube.com/Sreenet, and there you'll find my entire archive of more than 100 videos that we have done on the various shows. We'll show you the other show that we do and that we love to do is our every Sunday, the New York Times read along. 2 weeks ago, we had Rick Wilson, who's written who's a Republican who's written 2 books against President Trump. So you can imagine how people receive him, good and bad. Steve Shale is a Democrat. The 2 of them are Florida political experts. We had 86,000 people join us to watch that. Kanika Monga joined us. She's a rheumatologist. And you heard Dr. Kurian already mention some of the rheumatoid arthritis and other diseases that hydroxy is used for. And she talked about that. And then this week, we were so excited to bring you Corey Dean, who is the former science editor of the New York Times. She was with us and she was amazing. So please go into my archive to watch that show. And then next Sunday, 8:30 a.m. Eastern, I'm so excited. Joe Stiglitz will be here, Nobel Prize winning economist who writes about so many other things, including politics. He's going to be joining us. He's written 40 books, and only most of them are about economics. Rest are about life and history and politics. He's an amazing gentleman, and you will meet him. A Columbia professor, Joseph Stiglitz, will be here 8:30 to 10:30 a.m. Eastern this coming Sunday. So please watch that. And if you miss it, you'll subscribe to my YouTube channel so you'll find it. All right, let's go back to our doctor, and let me just show you Corey Dean's book. It's called Making Sense of Science, Separating Substance from Spin. This is something a doctor has to do every day. So let's bring back Dr. Marina Kurian. She's here, Surgeon Marina Kurian, a general surgeon. What is a general surgeon?
So a general surgeon does a lot of different things throughout the body. You know, we can operate on lumps and bumps under the skin. General surgeons operate on the neck. They do thyroid, parathyroid, different glandular surgeries. We operate in the abdomen. We do hernia stuff. We do gallbladders, appendix. We also do, what I do a lot of is bariatric surgery. All of the stuff in the belly, we kind of all are capable of doing some minimally invasive surgery, meaning small incisions and laparoscopic approach. And general surgeon really means that it's somebody that can do a lot, and breast surgery as well. We do a lot of different things. Now, there are specialties within general surgery, so you can specifically focus on breast. You can do endocrine, which means you're working with all the glands. You can work on specifically hernias or pancreas or just cancers that are in the belly. So it's a broad focus, but it's great training for a lot of different things. And then most of us decide to either subspecialize, or by the nature of whichever community that we're in, we tend to focus more on one aspect than the other.
And there must be such important work that you had to miss these 3 months or so, 2 months. So what was that like? And I know you got into the operating theater after a couple of months just last week.
Oh my gosh, that was so great. Honestly, you know, you're so used to going to work and the normalcy, whatever the word is, of your daily schedule and how it impacts you. Like you think, oh, I have to get up early and go in and do this. Well, guess who can't get up early right now unless I'm going into operate? Me. I'm like, oh, we have a talk tomorrow. I'm like, am I going to get up for that? It is incredible how when your routine is changed, how mind altering it is. And I was in a bit of a funk. I actually had I had articles to review and things to do. I wasn't in the operating room. I was doing telehealth, and I just couldn't do it until I started making lists like old school. Like when I was a resident, I always had lists and boxes that I would check off. And so I had to go back to that to actually get everything that I needed to get done, and it helped me focus. I wasn't even worried about going back to the operating room. I hadn't operated in 9 weeks. It is like when people are like, oh, it's like riding a bike. I'm not the best bike rider. So I was like, what's it going to be like? But it was actually completely normal, absolutely wonderful. Incredibly soul affirming for a surgeon to go back into the operating room and to be back with my team of nurses and techs and anesthesia, everybody there. It was just such a pleasure to be. It was like going back home. I spent so much time in the hospital and the operating room. It truly is a home away from home. So in some ways, being here during the day, people are talking about how your cats are like, I knew you were a loser and you never really had a great job, but this is why you're home. And your dog's like, oh my God, you love me. Thank God you're here. And I know that's why. It was very much like that, being home during the day, because you're just not here. And you realize that I thought my dogs didn't bark. They bark. Every time the elevator door opens, they bark. I had no idea because I'm never here for all of that. But going back to the operating room again, that was truly like wonderful. Just being back with your colleagues and doing just creating that normal routine and doing stuff that you do that you can actually do with your eyes closed, but we always keep them open. It just
yes, please, thank you. I'm glad you said that.
Yeah, don't worry. Our eyes are open. I'm all about seeing everything. And the other great part was that it was a very, very, I feel like my patients felt completely safe. We had done pre-testing on all of them. Everybody has to get tested before they come into the hospital. We also screened them with symptom questionnaires the week before. And then the day before surgery, we call them, they're screened again. And then on the day of, they're screened. And actually, once they get the test, they had to self-quarantine at home and not see, random new people. So they had to do that. And then we brought them in and did the surgery. And so far, my understanding from across the state, and it's, recent understanding, right, is that none of the elective cases or the patients that we've operated on that we screened and did all this for developed any COVID after the surgery related to the hospitalization. But that is certainly something that we're always concerned about and we're looking for and watching for symptoms. But I just saw my 4 patients that I did last week, and they're all perfectly happy and doing fantastically well.
And this is because elective surgery was banned for a while, right? That's why you had to do it. And some of your surgery is obviously not elective, it's emergency, but some of it is, meaning you don't have to do it instantly, right?
Right. So in our state, and I believe across the country, there's like 4 stages of, this is through the American College of Surgeons as well, endorsed by them. There are 4 stages of, or levels for a surgical patient. Level 1 is there's no urgency to this. It can wait, in essence. Level 2 is there could be some harm to the patient if you wait, more than 6 months. So it should be done as soon as we can introduce it into the system. Level 3, I believe, is, you have to have it done in a shorter time frame. And I can't remember if it's, 2 weeks to 3 months. And then level 4 is it has to be done immediately. So the level 4 cases were all being done. Some of the level 3 cases in the height of the pandemic were being put off and not being done immediately because that was not the time to bring in a patient that could wait 2 weeks to have even a cancer surgery. So that has been done. But what's now occurred across the country, there's a huge number of cases that we have as a backlog that we're all going to try and introduce safely and can't really be expeditious, but just safely into our ORs and into the schedules to try and get the cases done.
So you think, and that's possible to do. So I was pulling up your NYU page. Is that a good page for us to look at? Where else can we go?
That's me, but I'm also my own website, noobesity.com.
All right, we'll go there too and hear all your credentials and all of that. In medicine, everything is about credentials, isn't it? Including that continuous medical education that you all have to do?
Yeah, we do. We do tons of, and that's the thing. All of us are so webinared out right now. Like, we've been on Zoom calls for the different societies, and we're doing all these webinars, learning. I had one at 6 o'clock today. I have another one tomorrow evening at like 9 o'clock. And then Friday, something just popped up that I have to do as well. And we're trying to squeeze them in now that we're starting to do telehealth, going back into the office. That's another thing. Even as surgeons, many times we need to actually see or examine the patient, but there are certain situations where we can we can go and do a telehealth visit without actually having to see the patient.
And can you tell us, I see you also have a nurse practitioner. That's a term that is not well known outside of America for the most part. So what is a nurse practitioner? And she works with you, Jennifer Oliver.
Jennifer, yes. So nurses that want to do more education or have or more training can go through a variety of different master's and doctorate programs to become have specialized training. So a nurse practitioner is, and at least in New York State, and it varies around the country, nurse practitioners can operate relatively independently, but do need to have someone that they're affiliated with just to bounce issues off of. And my nurse practitioner, she's absolutely fantastic. And, you know, she is very well versed in my practice and a lot of the surgical issues that we look at. So she's perfect for my patients to see. They're all very comfortable with her. And, you know, she is a strong part of the practice and an incredible help, especially if I can't be there. So there's 2 days a week that I absolutely cannot be in my office. I'm operating, you know, and I can't rush over in between and see somebody and come back. So it's always wonderful to have somebody there that can, that I feel is a right hand person that could actually take care of things. And I have extreme confidence in her.
No, that's great. By the way, I just love that you have your high school education on your website as well, and you're not leaving behind that Stuyvesant pride. That's cool.
No way. Our Stuyvesant friends, we still hang. I mean, are you kidding? This is just like, but it's it's a great high school. I'm proud that I went there.
Yeah,
I also want to say that I work with a lot of nurse practitioners and PAs, and have throughout my career. When I was a resident and medical student, the PAs and the nurses would help you find your way. So you always had to be super nice to them, to make sure that they would help take care of you when you were starting out. And throughout my residency and even as an attending, nurses, PAs, NPs, they really make and break your day. Like, and having them on your side, and just, I think, and half the battle is just appreciating what they offer and their knowledge base as well, and that it's really an adjunct to what I have to offer or other doctors have to offer.
Sure. Last thing, let's talk about Mount Sinai Medical Center, where you studied as well. You completed your fellowship in laparoscopic surgery. What was that like to go through all that? How many years of education does it take to become a doctor?
So normally 8 years here in this country. Other parts of the world, it's really like you go off to university and you can enter a med school track, right? So it's 5 years in most other places. But here it's 4 years of undergrad and 4 years of med school. I did it in 6 years. There are a few accelerated programs. And when I did it, the accelerated programs were 6 years. Now the one that I went to at Union College is a 7-year program. And so after 8 years of college med school, I did 5 years of residency, but then I also did 2 years of research in the middle of that, and then another year of a critical care fellowship. So I happen to be triple boarded, triple X, I'm just kidding. Not physically capable of doing triple X as in Vin Diesel movies, but anyway, triple boarded. And then I ended up going to Mount Sinai. I did a research year there and advanced laparoscopic fellowship back when, it was early on. And so I think that is why when I broke in on the NYC scene in terms of being in my own attending and practice, I had a leg up on a lot of the other people because I had gone through such specialized training.
Sure. We said we'd be together for about 45 minutes. We're already at 49 minutes, so we got to rush through this so I can give you back your evening. Ashik is asking a very important question. Why is there no proper information from doctors apart from masks and distancing? I don't think that's quite fair. I think doctors are talking about a variety of things during the crisis. What say you, Doc?
So if you're looking for a doctor to say that you shouldn't socially distance, there is some discussion about, people were talking about herd immunity before, right? Like if you just let everybody get it, yeah, some people are going to die, but the majority of people will get it, and that's okay, and that's a good thing. But is it a good thing? This disease is not like many of the other, like a flu. This results in like severe respiratory distress, cardiovascular collapse, and it's not the same picture of a regular influenza. And so the resources that it takes to try and support someone to determine if they're going to make it or not, or to try and make sure that they do make it, is so immense that we have not been able to say, don't social distance, don't wear a mask. It doesn't make sense to do that. What does make common sense and also scientific sense is that if you wear the mask, you will protect people from you. And if somebody else wears a mask and they have a cold or something, that mask will protect you from them. And in terms of go get a test, don't get a test, we were caught by surprise, the entire world. And there's not enough testing for everybody, which is not fair. And then also, there may be tests that are available, but there's a significant false negative rate, meaning like you're like, oh, hey, I'm negative. But my colleagues have all told me stories about, I know this person has COVID and their tests are negative. So then they had to wait for the antibody test. And I had my doorman just told me, he's like, hey, I was sick with the COVID. I tested positive for PCR, which is their measuring. That's the nasal swab. They go deep and it's very uncomfortable. I had it done and it's not pleasant. And he tested positive. We went for the antibody test later, 6 weeks later, he didn't have any. So it highlights that the false negatives, even from the antibody tests, are not that are fairly high. They're not small numbers. So we're learning on the go here. And the fact that we've achieved so much just really shows you, one, that science is real and that sharing is really caring. Because if we did not get information from Wuhan doctors and Italian doctors, and I really think even more the Italians, like when they started having this, they shared so much information that it really gave everybody else that was facing the disease a leg up on what they, or at least understanding what they could expect. And as you know, we've lost in this country a lot of healthcare providers, but the Italians did lose a lot as well.
Yeah, including the health minister. Remember that? It was the man in charge of coronavirus died from the disease. It was very, very sad. All right, we're running out of time. Dr. Kurian, despite WHO guidelines, COVID-19 cases upsurge unprecedentedly, probably in India. Is this imply that new guidelines are needed? Like the question is, a lot of the people are saying, look, only 100,000 people died. It could have been much worse. So right. we panicked unnecessarily. I think the opposite is true, isn't it?
I don't think we could have prevented many of those deaths, and that's the problem. That is why, I have a good friend and incredibly smart epidemiologist person who feels like the economic impact of this shutdown is going to be far worse and far greater for the world economy and the world health, because people are out of work, and the world mental health than it was to allow the virus to run rampant. But when those initial models came out, they said that if we did nothing, 2.2 million Americans would die. That's a lot. That's a lot to expect in one fell swoop. That's a lot to expect in what would have been 3 or 4 months if we did nothing. So I think that, Cuomo putting down a, stay-at-home order from March 12th or 13th, that was a big deal. That helped mitigate the issues that we saw in New York City and also all around the state. I also know that all my friends were like, we like your governor. We wait for him to come on CNN, or I didn't realize it was going all over the country, but I think that was helpful. In terms of the WHO guidelines, we're learning as we go. And I think that we all need that grace. You guys got to give us that grace to figure it out, because this virus is unlike many viruses. It's also mutating as it goes, and what works in one area may not work in another. And then you're left with, is it environmental? Is it density of population? Is it the heat? Is it humidity? So there's so many other variables. Is it pollution that's adding to it? We just don't know. And so we need that grace. Unfortunately, there's no perfect answer to prevent you from catching it. But wearing a mask and practicing social distancing is going to help a lot. In every case, even in the States, like when you went and saw those beach parties, or like in March in Miami, people got sick. They didn't, maybe not all of them died, but who knows? They might have taken it back to somebody. And also the thing that we're all trying to do is contact tracing. And there was this great article that I just saw, how your phone can actually help you with contact tracing, but it's a lot of kind of Big Brother stuff in there, which I'm not a big fan of. But it is true that we have the technology to sort of do, like, okay, I got positive, so-and-so is positive. Maybe we can track, everybody can be a detective. But it might be a little more than we all want to do.
And that's one of the things that we don't know. Kavita says, hello, Dr. Kurian. Sam is watching from Canberra, Australia. Kavita's in New York. Sarah is watching from Kochi, India. Our families are from Kerala. And Jonathan says the second busiest subway station is in Manhattan. I wonder where the busiest is. Must be in Queens, maybe. What are some ways we can boost our immune system?
He's saying, I think Union Square is the second busiest subway.
Oh, yes, that's right. Like
busiest probably Grand Central or maybe Times Square. I'm not sure. Probably
right. You're right, and that's the one that you used to go to in high school. So Deep is asking, what are some ways to boost our immune system?
Hard to say, because again, a lot of the research is not so large numbers, but people talk about taking zinc. People talk about taking something called quercetin. I read something that was so excited about this Canadian scientist who'd been working on this forever, and he felt it was going to be a big impact, and they are doing some trials. And quercetin is spelled Quercetin, but I haven't given it to my kids. This is my thing to you guys. Like, I have zinc in the house, so that's happening. But I have not given a lot of the other things to them because I'm not sure that it's there. I think, my girlfriend, who feels that, we did more damage to the economy, she thinks that the biggest impact, if anybody walks away from anything with this, is to know that diet and exercise is actually something that could help save way, way more lives, right? Because what we are seeing in the COVID patients that did very poorly or got intubated is they mostly had a body mass index over 35, meaning that they had about 70 pounds extra on their frame. And that seemed to impact and was a strong predictor of who might end up on the ventilator.
That's true. Helm is watching from Las Vegas. And I know there are a lot of doctors' conventions in Vegas, but I presume you're not going to any doctors' conventions for a while, right?
Not right now. No.
Rose is
I have one scheduled for like mid-August, so I don't know. We'll see.
Well, I hope doctors are the ones who are at least being the most careful. Rose is watching from Connecticut, and she's one of our producers. Sarah says from Kerala, whose health minister Shailaja teacher is doing a great job keeping COVID-19 under control. More Keralites, people from Kerala, the state in India, have died in the US than died officially in Kerala, which tells you something about this American system. And may I ask you that, like, you are part of the system here, you're very proud to be an American doctor, and you happen to be Indian American, but what do you say to all these folks who are looking and pointing at America and saying, look at the disaster, and look at the disaster in New York?
Well, I mean, it's complicated. So India is probably just as densely populated as parts of New York City, right? But if you look at the zip code distribution, and this is something that everyone's trying to follow, so New York is tracking this as well. How come in certain populations of greater density where you're seeing higher COVID rates? So it has something to do with perhaps ventilation, perhaps proximity to your neighbors, how many people are in an apartment. Does it also happen, like, I go to 2 hospitals in New York, and this is purely my introspection, has nothing to do with actual facts or anything like that, but we saw perhaps less at my 2 hospitals than Columbia Presbyterian did up in Washington Heights, and also even Mount Sinai up near Spanish Harlem and Harlem. And I think they may have had something to do with the density. That's at least one theory that's been floated around in terms of the population. Now, that's what it is here. Why isn't that the case in India? Why isn't that, like, I thought for sure that, like some of the slums in Bombay, that this would be a thing that spread like wildfire. So either they're not reporting it, which I don't think is true, or there's some other aspect of the virus that we just don't know. And perhaps the heat has something to do with it. This is all pure, like, conjecture. I don't have any data past knowing what is happening, but I actually can't piece that together, because India could have had a much higher rate, except that it's their hot season and it's, maybe that.
There's not a lot of flu in India to begin with, right? So that's part of it. But we're seeing Brazil, where it was always worried, there were people worried all the time that there would be spikes and hot spots. Now Brazil is the second most affected in the world right now. Let's see. Julia says hi from Delhi. She's missing New York City. And Jonathan says you probably went to the 2nd Avenue Delhi, most likely. Our friend Roberta is watching from Richmond, Virginia. She's amazing. She is part of the Virginia Interfaith Center for Public Policy. And Rose says Venero's is a family-owned bakery downtown. I agree, the best cannoli.
Yep, you're going to have to go down now. You might be a little surprised, a little lemony sometimes, but hey, still the best.
And she links to them. That's awesome. Another Marina says, so wonderful to see Dr. Kurian again. Our parents were friends ages ago. I felt very proud to have the same name as someone so brilliant. Look at that.
Sweet. I don't know how brilliant. I couldn't answer every question, but I was doing my best.
Ashok says, I've been infected with malaria more than once and have taken hydroxychloroquine for the treatment. And let's see, thank you for answering my question. And we're just trying to get through these because I want to let you go. My mom is watching in Kerala. Hi, Amma, we love you. And she says, hi, Marina, your talk is very interesting. And you're all family, we're all family friends. And she often has said that how lucky your parents are that your kid, your daughter, meaning you, are right next door. You guys have kind of a family living situation separated by an elevator shaft. Is that right?
Well, yeah, they're very, very close. Thank God. Especially, it's just, I moved back to the city, and I happen to be a fellow at Mount Sinai, which where my mom had done her all of her career. And so I would make time every day just to go, and I'd bring her coffee and a muffin because she worked really hard, and, she wouldn't always take a break, and she didn't always eat lunch. And so, I felt like, and I felt like I don't see her, because when I first moved back to the city, I actually stayed with her, but my husband and I would go out at night. So it wasn't like I was really seeing her. So I would make time during the day to go see her. And, those are special times. Like, I'm so blessed to have both my parents. So I know my patients love seeing her in the office, and they keep asking, like, when's she coming back? I'm like, soon. And
you're going to bring her in for those.
She's like,
that was breaking news. I'm coming to the office. It's exciting. Look at this. Your old classmate, your young classmate, Himali Patel from Stuyvesant is watching. Sarah says that Kerala has stopped using hydroxy as prophylaxis. And Himali says hi. And Kavita says, I always say to the virus, catch me if you can, I follow the rules.
That's so great. It doesn't catch you. Actually, you know what? I got tested for the antibody, for the PCR. I was negative, and I thought maybe I was one of the false negatives, so I have it. So I went for the antibody test, negative. This is like one time where you kind of wish that you were positive, and it wasn't so bad that you got off with it easy. We had a couple of people, when I went back to the operating room, the nursing manager was like, yeah, I randomly I tested everybody, and I had like 4 to 7, it felt like, nurses that had come in completely asymptomatic, never felt like they had anything, and they tested positive, and they had to go back home. And our rules were, no fever, 3 days. But if you got tested positive, you went home for 7 days and then came back to work. Wow.
Anand says, why are there different opinions on drugs from the WHO, ICMR, which is the Indian equivalent of the CDC, et cetera? Why are there so many, also in America, some drugs are approved. In Europe, they're not approved, vice versa. Why can't there be just one standard for these things?
Well, in general, like our FDA is pretty stringent, and they were heretofore very, very strict about how they would approve and the level of data that they would need. And I feel that a lot of the European, like the CE marks for devices, et cetera, were not as stringent as here. Now, FDA has recognized that because of their stringency, there are a lot of patients that were untreated for a variety of different diseases. So they have tried to look at their process and address it. And in terms of why we have differences, it's the same. It's the same thing. Everyone wants to believe, if we're the U.S., we're going to believe U.S. data, or we're going to believe European data or Chinese data. So we're going to look at all of it, but we're going to go with the centers here and see what's happening in this country. And that's why probably some of the recommendations are different.
Got it. We just have a couple of minutes. I keep saying we have a couple of minutes left. We actually have no time left, but I just want you to hear these questions, if nothing else. Arunjit is saying, are you seeing any major advances in therapies to reverse the impact of the advances of MS in the body? I know that's not something you may know much or anything about.
Yeah, there was like probably about 18 months ago to 12 months ago, there was a new MS drug that was approved, and I know some of my patients are on it. But I think you have to, I don't, it's not my.
Yeah, let's not go there. George is tagging his friends. Julia is tagging her friends. Manjusri says it's really good. Watch it, guys. That's a good endorsement. What to eat or not to eat if you have a problem of thyroidism. Again, this is not a general medical show, but you can see the kind of interest there is in all of this. This is my mom watching from Kerala. Tim Sohn, who's a dear friend and someone we do a lot of work with. He was also the first person to ever advertise on my show. I'm so grateful. The president was asked if he should be taking insulin today. So why do you think they asked that? Is it because of his general health and?
Yeah, because of his weight, and they're wondering if he doesn't have diabetes, and he's just denying that he has anything. So I think that's why. That's really like a real dig, like, should you be on insulin? That's terrible.
But isn't it? I mean, what he's proven is that all the rules that we say, exercise, eat well. This is a guy who eats fried chicken and hamburgers all day, and look at how he's doing. He's still, so how do you explain that? He does no exercise.
You can't. Sometimes there are, as I said before on your show, there's altacacas and their genes just survive everything. I don't know that about the president. I don't know anything about his physical condition. His mental condition is something that we all see, and we can make our own interpretations. And neurologists have made their interpretations, as have psychiatrists. But there's nothing to say.
There's a word that most of our viewers may not have understood. So that's a New Yorkism. So you want to explain what that is?
An altacaca, it's Yiddish for somebody who has I think it's the genetic component where they just have really long life, and they usually live into their hundreds. There was actually a New York Times Magazine piece on altacacas.
Well, I tell you, if Donald Trump lives into his hundreds or 100 years old, I mean, that's going to really put a damper on the physical fitness industry, because he shows that you can do whatever you want and get that far. The lessons of HIV outbreaks seem to have been missed. When we think someone is catching a virus is a simple matter of behavior or morality rather than simple opportunity. Olinda says, good morning, nice cool shirt. Hello to your guest, just checked in. And Leica says, I'm excited to see Marina, our friend's daughter. We've known her since 1980, when she was 1 year old, or she was not even born in 1980. And thanks, Dr. Marina, everybody is saying. And thanks for bringing us topics that make us wiser. Wow. Why is the least to most risky activities for people in the summer, says Rose. What is the
So outdoor is much better. The NPR I'll see if I can forward it to you. NPR just put out a whole list on different activities. Being indoors is worse. Being outdoors and even 6 feet apart, being with your family outdoors, since you've already been together, is probably okay. But introducing new people, it's okay if they've also quarantined. And then you're kind of getting together in the backyard, and that would probably be okay. You have to watch the kids, because kids don't practice social distancing at all, and they have, they're just going to be close. So we're not going to get into that multi-inflammatory system thing that's happening, disease that's happening with children, but it is still a concern. But the NPR put out a great thing on that, and hopefully, I don't know if you post a link, or you could probably
or you can in your own Facebook. When you just go to Facebook, you'll see. And I hope you shared this on Facebook already. If not, you'll share the recording, and then you can put it in there. Helm says, I've been drinking turmeric, cloves, honey, and in his Earl Grey. I guess there's no harm, right? He's doing yoga.
Sure. That's all good. Those are all great things. You want to be more fit. You want to watch. Southeast Asians, we're prone to hypertension, diabetes, cholesterol issues at a lower weight than many of our ethnic counterparts. So it is something to be careful and to watch out for. And so people here love turmeric.
Yeah.
I eat it whenever I go to my mom's, I'm eating turmeric. I don't think I'm eating as much as they are getting in those pills, but.
Right. Helm says, hi, Dr. Kurian, such a fan. The Bangladeshi community has been hard hit in Queens. Very sad. More Keralites in New York than in Kerala. Very sad. Did not know that. Olinda also says, what if the people in slums have a higher immune system? Their food habits, eating everything is fresh, not processed foods. And Kavita is asking, the Bombay rainy season starts in July. What could be the impact on coronavirus and vice versa? I'm not sure you would know. I don't think we're
going to all watch and wait and see what happens.
And Daft Punk is saying hi to my mom. Nitin is watching from Dharamshala, the home of the Dalai Lama. Are you guys tempted to switch to talking Malayalam at times?
No, my Malayalam is so bad, like the accent, that my mom still chuckles when I talk. It's kind of, no.
I actually like speaking Malayalam, but it is also very badly accented, mine. And
I talk to my mom more in Malayalam now than I ever did, but we spend a fair amount of time together. And I think she can only hear me in Malayalam. When I talk to her in English, she's like, what?
Kavita says, Marina, do you have siblings?
I have 2 siblings. My sister's the oldest, and then my brother. And he's out on the West Coast. My sister's in Philly.
So the experts were kind of hoping that the virus would recede during the summer. That didn't happen. Is there even a point to the lockdown anymore?
So summer hasn't happened yet. June 21st is summer, right? And it's just starting to get hot in New York. I'm not sure where Daft Punk is from.
In India, they consider the summer earlier because the hottest year.
So, but also India, considering the population, has not had as significant a peak in coronavirus as would have been expected, as you said, Brazil has had, or Italy.
Yeah. Sujana, our friend Sujana Chandrasekhar, another doctor, says amazing breadth of information. Kavita says the president can take anything. She says carefree New Yorkers. My father is watching. Hi, Acha. And Rose has already linked to that NPR article.
Perfect.
She's on the case.
I have a lot of great information.
And my dad says, great to see Marina. And the other Marina says, thank you, Sree, and your staff. And thank you, Dr. Marina. We don't have staff. We have producers who are so great. When will the vaccine be available?
Probably. So, I'm a surgeon. I'm an eternal optimist. And I feel like it's going to be available in 3 months. But
the worry is, will Americans take it? There are so many people polluted by misinformation, thinking that vaccines are bad for you.
Yeah, I think that people will take it. I think, it'll be interesting. What's the measure of when you can go back to work, right? Google's saying, maybe next year. I mean, in the New York offices, like Facebook, if everything can be done remotely, think how much all these companies are going to save on, in terms of, rent and all the other things that they do. Like Google has that whole free food spread, et cetera, right? But I think that ultimately people do work better together in person. And so if one of the parameters is your, what's your antibody status, or, did you get the vaccine, then I think that we'll see a little bit better taking of the medication, of the vaccine. I mean, who knows? It feels so like Big Brother-esque, right?
Yeah, we don't know, and that's we started the show saying we don't know.
But I'm going to get that vaccine as soon as there are vaccine trials at each hospital. I didn't get into the NYU one, but I would have taken it.
Yeah, well, you know your sign. So with that, we're going to let you go. Thank you so much.
Thank
Our
you.
guest has been Marina Kurian. She's at Marina Kurian on Twitter. On Instagram, she's MarinaKurianMD. Please, on Instagram, please follow her on Twitter and on Instagram. And you can also find her on the internet very easily. And if you need surgery, check her out in New York. But otherwise, thank you so much, Doc. We really appreciate your time. And we look forward to seeing you another time on our show. Thanks, Doc. All right, and that was Marina Kurian. Thank you so much, Marina, for being here, and to our audience, people all over the world watching. We're so delighted and so grateful to you for your time and attention and for being with us. And we want to remind you that we are sponsored by Priyamvada Sustainability Consulting, and these are folks whose motto in their slogan is that we can be your chief sustainability officer as a consultant. And clean-futures.com, clean-futures.com, check them out. And also a reminder that I'm teaching a global free fundamentals of social media course, free certification. It's about a 2-hour class that you can take over time, or you can binge watch it and take it all at the same time. mrac.co/social, mrac.co/social. Thank you so much. We're looking for ideas, speakers, themes, and sponsors. So please message us. We'd love to have you, to have your message with us, or to have you as a guest. Please let us know. Our email address is right there, sree@sree.net. Please find me on Twitter. And please, please, please go to YouTube and subscribe to my YouTube channel. Thank you very much, everyone. We'll see you again right here on